Rift Valley fever, a viral disease that can devastate both livestock and human populations. Today we'll explore everything medical professionals need to know about this dangerous zoonotic infection. Rift Valley fever, or RVF, is a viral zoonotic disease that affects both animals and humans, causing widespread concern due to its rapid transmission and severe outcomes. Caused by the Rift Valley fever virus, the disease primarily impacts livestock such as sheep, goats, cattle, and camels. But humans can also become infected through mosquito bites, contact with infected animals, and consumption of infected animal products. Rift Valley fever is an acute viral disease that affects both animals and humans, but it is most commonly associated with livestock in sub-Saharan Africa. The disease is caused by the Rift Valley fever virus, which is transmitted primarily through mosquito vectors. Although RVF is not usually fatal in humans, severe cases can lead to hemorrhagic fever, encephalitis, and even death. Understanding the transmission and prevention of RVF is critical for protecting human health and controlling outbreaks, especially in rural and farming communities. The disease gained international attention when it first emerged in Kenya in 1931. Since then, it has been reported in various parts of Africa, the Middle East, and parts of Asia. Rift Valley fever is caused by the Rift Valley fever virus, which is an RNA virus belonging to the Phlebivirus genus. The main carriers of the virus are mosquitoes, primarily species of the Aedes and Culex genera. These mosquitoes become infected when they bite livestock or wild animals that carry the virus, after which they can transmit the virus to humans and other animals. The primary mode of transmission to humans is through the bite of an infected mosquito. These mosquitoes breed in stagnant water, which is more abundant during the rainy season. The symptoms of Rift Valley fever can vary in severity, ranging from mild to severe. A sudden onset of high fever is one of the hallmark symptoms of RVF. Tiredness, weakness, and a general sense of being unwell are common early symptoms. Many individuals with RVF experience severe headaches, muscle aches, and joint discomfort, particularly in the limbs. Nausea, vomiting, and abdominal pain may also occur, and in some cases the virus causes eye inflammation, leading to redness and discomfort. In rare cases, RVF can progress to more severe forms of the disease. Hemorrhagic fever is the most serious complication. The virus can cause inflammation of the brain, leading to confusion, seizures, and in severe cases, coma or death. Some individuals develop eye complications, including damage to the retina, which can result in vision loss. RVF may cause hepatitis, characterized by jaundice, abdominal pain, and liver failure in extreme cases. Diagnosis of Rift Valley fever is based on clinical signs and laboratory confirmation. PCR is the gold standard for diagnosing RVF. Blood tests to detect antibodies against RVFV can confirm a recent or past infection. In some cases, imaging such as ultrasound or CT scans may be used to assess the extent of liver and spleen involvement. Early diagnosis is crucial for timely treatment and to prevent the spread of the disease to others. Currently, there is no specific antiviral treatment for Rift Valley fever. Most patients with mild RVF recover with supportive care. Patients with severe forms may require hospitalization for IV fluids, blood transfusions, and close monitoring of vital signs. No specific antiviral drugs are available for RVF, but research is ongoing to identify potential treatments. Some antiviral agents, such as ribavirin, have shown promise in laboratory studies. Preventing Rift Valley fever involves both vector control and protective measures for those at risk. There is an RVF vaccine available for livestock, which can help prevent the virus from spreading to humans. People who work with livestock should wear gloves, face masks, and other protective gear. People should avoid consuming raw milk, undercooked meat, and other animal products from infected livestock. Monitoring animal populations for early signs of RVF can help detect outbreaks before they spread to humans. The prognosis for Rift Valley fever depends on the severity of the disease. In most cases, individuals with mild symptoms recover fully with supportive care. People with mild RVF usually recover completely within 1 to 2 weeks. The fatality rate for severe forms of RVF can range from 1% to 50%, depending on the region, the patient's health, and the timing of treatment. Rift Valley fever is a dangerous viral disease that can have severe consequences for both livestock and humans. Early diagnosis, supportive care, and preventive measures such as mosquito control and livestock vaccination are key to managing the disease and preventing its spread. Rift Valley fever, or RVF, is a viral zoonotic disease that primarily affects livestock and can spill over into humans. It is most common in sub-Saharan Africa and has appeared in parts of the Middle East. RVF is caused by the Rift Valley fever virus, a member of the flebovirus genus. Transmission occurs mainly through mosquito bites and contact with infected animal products. In this guide we will cover causes, symptoms, diagnosis, treatment, and prevention of Rift Valley fever. Rift Valley fever is a zoonotic disease transmitted between animals and humans, primarily affecting cattle, sheep, goats, and camels. The virus infects livestock and can cause high morbidity and mortality in young animals and abortions in pregnant animals. Humans become infected through mosquito bites, direct contact with infected blood or tissues, or consumption of unpasteurized milk. RVF gained global attention in 1977 during a large outbreak in Egypt that caused significant human cases. Since then, outbreaks have recurred across Africa with occasional spread beyond the continent. Key point: RVF is zoonotic, livestock-associated, and transmitted via vectors and contaminated animal products. RVF virus is transmitted by mosquitoes, especially Aedes and Culex species that breed in stagnant water. Heavy rainfall drives mosquito population surges and often precedes RVF outbreaks. Mosquitoes transmit the virus from infected animals to humans, creating a zoonotic bridge. Direct contact during slaughter or butchering with infected blood or tissues is a major human exposure route. Consumption of raw, unpasteurized milk or undercooked meat from infected animals can transmit RVF. Nosocomial transmission is possible when infection control is inadequate, so hospital protocols are essential. RVF is highly seasonal and linked to rainfall patterns that create mosquito breeding habitat. Vector control, eliminating standing water, insecticide use, and nets, reduces transmission risk. To summarize, transmission occurs by mosquito bites, direct animal contact, contaminated products, and rarely in hospitals. Most human infections present with an acute febrile illness: fever, chills, severe headache, muscle and joint pain. Headache and profound myalgia are common, often accompanied by nausea, vomiting, or diarrhea. Conjunctivitis can occur, producing eye redness and discomfort in some patients. Severe infections may involve the liver, hepatitis with jaundice, abdominal pain, and hepatomegaly. Rarely, RVF progresses to hemorrhagic fever with bleeding, shock, and organ failure requiring intensive care. Encephalitis is another severe complication. Patients may develop confusion, seizures, or coma. Retinitis with retinal hemorrhage can cause vision impairment in some cases. Remember, most cases are mild and self-limited. Severe complications are uncommon but can be life-threatening. Definitive diagnosis is laboratory-based. PCR is the preferred method to detect RVFV genetic material early in infection. Serological tests detect antibodies and help identify recent or past infection. Virus isolation is possible in high-containment labs but is rarely used for routine diagnosis. Early testing is critical for patient care and to prevent further transmission. There is no specific antiviral therapy for RVF. Management is supportive: hydration, analgesia, and fever control. Severe cases may require hospitalization, intravenous fluids, and blood transfusions when indicated. Research into antiviral treatments is ongoing, but none are currently FDA approved specifically for RVF. Antibiotics may be used to prevent or treat secondary bacterial infections in severe patients as clinically indicated. Prevention relies on vector control, insecticides, eliminating standing water, bed nets, and repellents in high-risk areas. Vaccination of livestock reduces animal disease and human spillover. Vaccines exist for animals and can be an effective control tool. Personal protective equipment and safe handling during slaughter or meat processing protect workers from exposure. Surveillance of animal populations and early warning systems enable rapid outbreak detection and response. Avoid consuming unpasteurized milk and undercooked meat from potentially infected animals. Prognosis varies. Most recover fully with supportive care, but severe cases have substantial morbidity and mortality risk. Combining diagnosis, supportive treatment, vector control, animal vaccination, and surveillance reduces impact and saves lives. Sources for further reading include the World Health Organization, CDC, and the U.S. National Library of Medicine. Thank you. If you found this useful, subscribe for more clinical and public health briefings, and let us know when you're ready for the next article.